This is Jamie Drummond for Good Food Revolution. We are joined by our good friend Jill Bucaro from Wellness Riot, joining us today from Georgia. How are you today, Jill?
I'm really good. How are you, Jamie?
I am fantastic, thanks very much.
Good.
Now, today we are going to be speaking about the topic of health coaches, a relatively new thing to me. I hadn't really heard of them before, but if you wouldn't mind explaining, what on earth is a health coach and why have they risen to prominence in the most recent years?
Yes, that's an excellent question. And I think really kind of leading up until now, there wasn't a very good definition
Right.
because it wasn't a regulated term. So there could be health coaches that, focused on nutrition, and there could be health coaches that worked on exercise, and there could be health coaches that recommended supplements and worked on stress and everything in between. And so, but really at the foundation, coaches help people make changes related to health and wellness, particularly when those changes are difficult, right? Or challenging, because otherwise, like, you wouldn't need a coach if it was
Yeah.
easy. So we're partners, collaborators, guides for people that are trying to make a change with regards to their health and wellness.
I see. Now, is there a certification to become a health coach?
There is, and it's pretty new, all things considered. It's
Right.
about 6 or 7 years old.
I see.
And so here, well, there's a couple, but the one here in the US is the National Board of Health and Wellness Coaches. And so that their goal really is to level up level out the playing field and the profession of health and wellness coaching, because it is a little bit of the Wild West. And
Yeah.
so there is this board certification so that, the potential client's consumer knows what they're getting into. And I think that really is all going to help, not only us as individual coaches, but the coaching field and the alternative health and wellness space. Because people know, for example, what an accountant does, people know what a dentist does, but
Hmm.
most people, if you asked them, wouldn't know and be able to describe what a health coach does. So this board certification is really helping to kind of standardize what health coaches bring to the table. And so that they're leaving this certification and heading out into the world as knowledgeable, safe, competent. And the other thing that's so great about this particular board is that in conjunction with the NBME, which is the National Board of Medical Examiners,
Okay.
that's who is giving this board certification. So if you know any medical doctors, nurses, surgeons here in the US, that's the same board that is overseeing their exam. So a ton of potential to really meet and integrate with the conventional medicine
So I,
community.
I guess that one of the reasons that the term has come to prominence over the last few years would be because of this reasonably new certification.
Hmm. Yeah, and I think too, the realization that this conventional medicine doesn't really have the time, or it's not built into their process to meet with somebody and really give an hour of their time every week or every other week to help them really make these behavioral and lifestyle changes. And we're dealing with chronic illness and health challenges today that are very complex. There's many layers. It's not just, this acute, infection or, some sort of challenge where it's like, oh, it's an antibiotic, it's a procedure, it's not like it used to be, but we still kind of try to treat it that way. The medical system, I think, still tries to treat these very complex health challenges in that same way. A 15-minute, appointment. Tell me what's wrong as fast as you can, and I'm going to try to prescribe something for you. Even if, and I think a lot more doctors do understand the benefits of diet and lifestyle change, they're not equipped to support it. So if you've ever left a doctor's office with a pamphlet, a to-do list, a stack of papers, right? And it's like, if you've never eaten anti-inflammatory foods before, how in the world are you going to actually do that? How do you lower your cholesterol? How do you lower your blood pressure? So that's where health coaches can come in and understand like what the client or the doctor's patient's trying to do, how to implement it. How are we actually going to get you to eat greens? How are we actually going to get you to move your body in a way that's sustainable and comfortable, right? And gets you to where you want to go.
So this isn't a kind of once a year, twice a year appointment. This is something over the course of a month or months, and that a person continually comes back to see this coach regarding where they want to be, I guess.
Yes. Yeah. Most coaching programs are 90 days, 6 months, maybe even a year, depending on what kind of like health challenge they're dealing with. And the reason for that is because we want to see the clients through different phases of their life, like so maybe you go on a vacation, maybe you get a different job, maybe the kids are in school or out of school, maybe you go through a holiday, right? So we get the opportunity to work with our clients like during different stages of their life, but also we get to take smaller steps. Like what seems manageable? Let's do one or two things today. Try that for a couple weeks and then we can add on.
Right.
It's, the 92% of New Year's resolutions fail because nobody becomes a different person overnight. That just is pretty uncommon. So working with somebody over a period of time allows us to make those steps in a sustainable way. So something that they could continue with, life after coaching.
So if someone approaches you, one of your clients, do they come to you with are they aware of what their aims are when they come to you? Do they give you an idea of goals, or do you set those goals for them?
We are very client centered with
Right.
health coaching. It's one of the foundational ideas is that we're working with the person in front of us. So we collaborate. If they don't have any goals, we'll have the conversation, maybe brainstorm on some places they could go, ask them questions that would kind of open up that conversation. But we really have the client set the goals because they're more meaningful. Like, they're like, who cares what I think you should do? What do you want to do? And where do you want to go? And that's the other thing that coaches are really focused on is where do you want to go? What's that goal? What's that vision? And how do we get there versus what's broken and let's fix it, right? Like we're really kind of focusing on that positive psychology, that positive reframe, because the evidence has shown people are more motivated when they're like, oh, they feel good and they have a goal and a vision rather than like, oh, all these things are wrong. I'm never going to fix them. Right. So we work a lot with mindset too, through things like that goal and vision process.
So when we get together every month, most of our conversation focuses around food, around diet. When it comes to your work as a health coach with your clients, how much of that is diet related, and does it move into any other areas outside nutrition?
Yeah, I think a lot of clients come with nutrition or diet requests or
Yeah.
goals. They know they should lower refined sugar. They know they should maybe drink more water, eat more vegetables. But we definitely look at the whole person, and it's rarely just the diet. I mean, that plays a big part. And I think if you eat foods that are nourishing versus foods that aren't, you can
Yes.
feel a lot differently as the same person. But what is leading you to make the decisions that you make with regards to eating, right? Because they say knowledge is power. But if that was true, I mean, we'd all eat a little bit differently,
Yeah.
probably, right? Because most of us know, we should eat some more vegetables. We should cut back on fried foods. So it's really that action. And so that's where the health coaches come in. Like, is it stress related? Are you not sleeping? Is it your schedule? Like, what's your nostalgia? What's your history of, do you like to cook? I mean, there's so much going on. And diet's definitely at the center and can be foundational. But like, I know a lot of people that are eating perfectly, but they're still just not feeling well because they're in a toxic work environment. They're not sleeping. They feel a lack of community, whatever. There's a million other things that could be happening. So while diet and nutrition play a central role, it definitely stands out from there.
So how does your work integrate or align with that client's family doctor, their chiropractor, their personal trainer, perhaps their nutritionist, their dietitian? How does all of that come together?
So we really feel like we're a support system
Right.
for whatever other professionals they're working with.
I see.
And so we ask a lot of questions about what other professionals they're working with and how can we align with them. So a doctor is a really good example. Like I mentioned, maybe they walk out with some recommendations, and some suggestions. So we align with, okay, this is what your doctor wants. How can we implement that? What feels good to you? What kind of movement can we do? Or a personal trainer, maybe they give them an exercise regimen, but they never do it.
Yeah.
So we help them implement, maybe we can work up to it. Maybe it's planning, maybe we work on preparation or, time management so they can fit in what they want to do. So we're definitely, and we make that very clear too when we're talking to clients, like what other providers or professionals are they working with, and to be in full alignment because team care is on the rise, right? So, and that makes a space for health coaches, but a provider, a specialist, a nutritionist, a health coach, like I really feel like that team care is going to give the patient or the client the best possible experience. And that's what it should, I mean, that really at the end of the day, whatever side of medicine you're on, I mean, that should be the goal, is what's in the best interest of the client or patient.
It makes sense to me. Now, if people have been watching this and perhaps they're not familiar with the term health coach, where would they go for more information about that?
Well, I'm glad you asked. So I actually lead a school called the Institute for Holistic Integrative Studies, and we teach health coaches. So we're a
Right.
board approved training program that people can sit through and qualify to take that board exam. But our website is ihistudies.com. And so we have tons of information on there about health coaching. And they could also go visit the board website as well, which is nbhwc.org. And they have tons of information about that certification, which I think, again, is so important to kind of, get yourself above the millions or thousands, hundreds of coaches and really separate yourself, as somebody who, can work with and can integrate with that medical community.
Fantastic. Well, Jill, thank you very much for giving us such a great insight into what you do when you're not here on Good Food Revolution. And we look forward to catching up with you next month on a topic to be decided.
Ooh, fancy.
Thanks so
Thanks,
much, Fonzie.
Stevie.
Bye for now. Bye-bye.
Bye.